Enteral anesthetic agents, and these are used for induction of anesthesia, and rapid onset of action is there with IV agents. Recovery is mainly by redistribution, and it also reduce the amount of inhalational anesthetic agents which is required for maintenance. And the examples we have already read, these are thiopental or thiopental sodium or midazolam, propofol, etomidate, and ketamine. Now let's see the individual parenteral agents. Thiopental sodium, its T-half is 9 hours and it has high lipid solubility, and because of high lipid solubility it is ultra short acting with the duration of 5 to 10 minutes. And the reason behind the ultra short action is its redistribution, and because of redistribution there is a rapid recovery from anesthesia and consciousness is regained in 10 to 20 minutes. Now you can see here that if T-half is 9 hours, then why the effect vanishes within 5 to 10 minutes? So reason behind that is redistribution, and because of ultra short action the rapid induction is also there, that within 20 seconds in one arm brain circulation. That means when we give thiopental sodium in the arm as a intravenous agent, so from arm it reaches towards heart and from heart to brain. So this is one arm circulation. As soon as it reaches the brain it shows its effect, and then it is redistributed towards the other parts of body and other tissues, and because of its high solubility it stays there. So the effect come as anesthetic agents very fast. Instead of the T-half of 9 hours, the duration is of 5 to 10 minutes. And if you want to increase the effect of anesthesia, then it should be given with the continuous infusion. Again, the complete recovery takes time of more than 9 hours, that is more than its T-half, because it has high lipid solubility. So the tissue will not leave the drug immediately, hence complete recovery takes time. Although the patient has come out of anesthetic effect, but the recovery takes time. Complete recovery takes time of more than its T-half, and it also produces hangover because of this effect. It does not possess analgesia. So unlike the inhalational agents which possess good analgesia, specifically the nitrous oxide, all the IV agents does not possess the analgesic or the muscle relaxant effect. But the inhalational agents are good analgesics as well as good muscle relaxants. So the thiopental sodium requires nitrous oxide and fentanyl along with as a painkillers. No muscle relaxation is there, hence it's required the short acting succinylcholine as a muscle relaxant for short procedures, because thiopental sodium itself is ultra short acting inducing agents. So if you will give along with a good muscle relaxant, so for short procedures the thiopental sodium can be used as anesthetic agents, for example intubation, bronchoscopy, endoscopy. But the thing which need to be remembered is it should not be mixed in the same syringe because it reacts chemically. So thiopental sodium should be given separate, and the succinylcholine should be given separate injections, and they should not be mixed in the same syringe. In consciousness is there, and resistance to mold or telling lie of the subject is lost when the thiopental sodium is given, and this property is used as a truth serum. And but if what are the answers are being given by the patient should not be considered as relevant all the time. It increases all the pressures except blood pressure. So unlike inhalational agents which reduces almost all the pressures, the IV agents increases all the pressures, but blood pressure is not increased by thiopental sodium. So it increases intraocular pressure, hence it is contraindicated in eye injury. It increases intracranial pressure, hence the thiopental sodium is contraindicated in trauma, hyperkalemia, and crush injury. But as it reduces the blood pressure, so it should be contraindicated in shock or patient having hypotension. What occur with extravasation? So if the drug leaks out of the injection site, it may cause pain, necrosis of the tissues, and gangrene can also occur. and the pain can be reduced with the giving lignocaine along with the thiopental sodium. It also possesses potent anticonvulsant properties, so it is used in status epilepticus where other drugs does not act or fail to act. Now let's see the propofol. The patient feel better than giving thiopentone because it has a rapid induction because of high lipid solubility and preparation is oily. It has rapid recovery, 10-fold faster than the thiopentone sodium due to faster metabolism, and it can also used as daycare anesthesia. That means on the same day the surgery has been performed on the patient, and because of faster recovery patient may go home. So this is the daycare anesthesia. On the same day patient can be relieved from the ward. It is non-irritant to airways, so can be used for maintenance also. So no need to give separate for induction and as well as maintenance. Propofol itself can act as inducing agent as well as for maintenance agent. So this one property is also helpful to make it as a daycare anesthesia. It also possesses anti-emetic properties, so no post-op nausea, vomiting is there to the patient. It is safe in pregnancy as well, although it crosses the placenta, but still it is safe in pregnancy. There are certain disadvantages, like it releases histamine, so it may lead to anaphylactoid reaction. It also lead to respiratory depression as well as hypotension, just like thiopentone sodium. There is a pain at injection site after giving propofol, and there is propofol infusion syndrome when it is given with the high rate of infusion and if it is given for prolonged time period. So there can be propofol infusion syndrome will be there. Phosphoprofol is a drug which is water soluble alternative to propofol, and it does not cause hypotension or respiratory depression, so it can be a good alternative to propofol. And altenolone is a painless injectable IV anesthetic agent having less cardiovascular side effect as well as no respiratory depression. So these two are the newer drugs, can be used alternative to propofol. Let's see the benzodiazepines. These are slower acting, used for maintenance of anesthesia and used for short procedures like cardiac catheterization, angiographies, electroconvulsive therapy, close reduction of fractures, and endoscopies. It produces sedation, amnesia, and unconsciousness within 5 to 10 minutes, and consciousness is regained within 1 hour. It do not depresses respiration, myocardium, or blood pressure, and action is reversed by flumazenil. So if overdose occur, in that case antidote flumazenil is available there. Midazolam is a good benzodiazepine anesthetic agent which is used commonly because there is no thrombophlebitis unlike diazepam, and it is used to produce sedation and amnesia without analgesia in short procedures which does not require pain relief like endoscopies, bronchoscopy, cardiac catheterization, patient on ventilators, pre-anesthetic medication, adjuvant to general anesthetic agents, status epilepticus type of conditions where midazolam can be used. Ketamine is another one important drug among IV anesthetic agents. It is known as dissociative anesthesia. Dissociative anesthesia is because it dissociates the person from surrounding as well as from own body. Its characteristic features are that it is a profound analgesia, immobility, amnesia with light sleep, and but poor muscle relaxation. So as we have seen that IV anesthetic agents are not good analgesic, but ketamine is a good analgesic agent, so it does not require any analgesic along with it, but it increases sympathetic stimulation or increases sympathetic activity. Hence it is a potent bronchodilator and suitable for asthmatics. It is useful for patients with circulatory volume loss, that is, as it increases blood pressure. Unlike other IV agents which reduces blood pressure, but because of sympathetic stimulation, it increases blood pressure. Hence, this anesthetic agent can be used in patients having circulatory volume loss, like dehydration, vomiting, hemorrhage, shock, anemia. And it is also suitable for low general condition patients like geriatric patient or in children also. This is a very good anesthetic agent, can be used in children, geriatric population, and patient having low general condition. There are certain disadvantages, that it increases all the pressures including blood pressure. It is a derivative of phencyclidine, So it's a hallucinogen. That's why emergence delirium, hallucinations, and involuntary movements occur during recovery, which can be minimized by giving diazepam or midazolam to the patients. And this point is to be remembered at it is used in most of the MCQs. There are contraindications like hypertension, myocardial infarction, and increased intracranial tension as it increases all the pressures. There's a term called balanced anesthesia. Uh, more more than two drugs when are given along with, like a multi-drug approach is used to manage the patient's needs. Balanced anesthesia takes advantage of drugs' beneficial effects while minimizing each agent's adverse qualities. Like when more drugs are given along with, their dose will be reduced, hence their side effect will be reduced, but the beneficial effects are add on to the combination. It is achieved by inhaled anesthesia given along with the IV anesthetic agents and pre-anesthetic medications. Then what are these pre-anesthetic medication? That means it is used the use of drugs prior to anesthesia to make it more safe and pleasant. That is to relieve anxiety of the patient by giving benzodiazepines, because if it will reduce the anxiety, the dose of the drugs will also get reduced. To prevent allergic reaction, antihistamics are being given. To prevent nausea and vomiting, antiemetics. And to provide analgesia, opioids. To prevent acidity, proton pump inhibitors. And to prevent bradycardia and secretions, atropine, glycopyrrolate, and hyoscine type of pre-anesthetic medications are given prior to general anesthesia. There is a term neurolept analgesia, that means which is characterized by calmness, psychic indifference, and intense analgesia without total loss of consciousness. It is the combination of fentanyl and droperidol. So neurolept agent here is droperidol. It is an antipsychotic, and analgesic here is fentanyl. But adverse effect in the form of chest wall rigidity because of fentanyl, slow recovery, respiratory depression because of fentanyl, which is an opioid analgesic, and extrapyramidal side effect because of droperidol, which is an antipsychotic, may occur. There is a term neurolept anesthesia also there. If we include nitrous oxide and oxyn along with droperidol and fentanyl, then this will become a neurolept anesthesia. Thank you.